Hi there, my name is Natalie Metcalf. Today we're going to be inspecting the abdomen. I'm using my daughter Lily as my patient. So first thing you're going to do when inspecting the abdomen, you're going to inspect. So you want to look at the belly. Lily has a flat belly. Her contour is flat. It's symmetrical. Her umbilicus is midline. Um, she's relaxed. She doesn't seem like she's in any pain. There's no hair distribution on her abdomen. I don't see any pulsations or movements other than her normal breathing. And her skin is pink, warm, and dry. So, her belly looks good, normal belly. Next thing that we're going to do is we're going to auscultate. We're going to listen with our stethoscope. We'll listen in all four quadrants, listen to bowel sounds, see if they're normal, see if they're hypoactive, hyperactive. So we'll do that first. Lily's bowel sounds are normal. She must be hungry. Her stomach's growling at me. Next thing that we'll do, as far as vascular sounds, I didn't notice any vascular sounds in her abdomen other than the normal bowel sounds. We'll also listen to the aortic artery and the renal artery. Make sure that, and the iliac artery as well. So we'll check the aortic artery first. Um, Sounds normal. No bruise heard in any artery. So next thing that we're going to do is we're going to percuss the abdomen. Um, so um, measure the liver span, percuss the borders of her spleen. First thing, we're just going to make sure that there's no dullness, no masses, tumor, anything like that that can and cause an abnormal assessment. So go ahead and relax for me, Lily. Okay. Okay, that sounds good. We can measure the liver span by percussing up until we get to the liver. Right there, it sounds pretty dull. And then we can go up here in the intercostal spaces. So dull. And usually what you would do is we would be able to mark that, the borders of the liver. And usually between the 9th and 11th intercostal space there. So that's normal. We can also check for dullness around the spleen. No dullness felt. The other thing that we will do is check the costovertebral angle tenderness, and this is how you check for tenderness in the kidneys. So I'm going to have Lily sit up for me. And what you can do is place the back of your hand on the back, and you can kind of just tap with your fist. Lily, does that hurt? And the patient can tell you if there's any pain. Usually if the patient does complain of pain, then there's some kind of inflammation at the kidney. Okay, go ahead and lay back for me. Next we're going to do is palpate. So we're going to do a light palpation first, and then we'll do a deep palpation. So, okay, didn't feel any masses or lumps. Don't notice the patient grimacing that she's having any pain. So then we can move on and we can do our deeper palpation. So we can palpate and try to palpate for the liver border. Try to palpate for the spleen. I don't. Palpate the spleen. So that's good. That means the spleen is not enlarged. You can palpate for the kidneys. So that would be a lot harder to do as well. You can palpate for the aorta in a deep palpation. You can feel the aorta and the pulsations of her pulse. You can check for any fluid wave, no fluid wave in her belly. Any inguinal area for nodes, pulses, hernia. I don't notice any hernia or any masses on her belly. You can check her inguinal nodes, which would be, I won't expose her, but would be down here. Check any lymph nodes for any swelling, tenderness. Okay. So Lily has a normal belly. I didn't notice any abnormalities, and that's it for our abdominal assessment. Thanks.